Now, as we struggle to navigate yet another heavy cold and flu season, it is important to uncover some misconceptions around the overuse of antibiotics, specifically the misuse in treating viral infections like the common cold and flu.
That's right. This segment is sponsored by Mucinex. Joining us now to talk about this and help you safely and effectively manage cold or flu symptoms is Dr. Ken Redcross. Thanks for joining us, Dr. Redcross. We appreciate you.
Thank you, Jacqueline, Jason. It's great to be on with you guys.
Yeah, for sure. So doctor, why is there a growing concern about the widespread inappropriate use of antibiotics, and what impact does that have on public health?
You know, it has a big impact, everyone. Look, we're starting to recognize that when antibiotics are used inappropriately, it increases antimicrobial resistance. How does that look in our society? Well, last year, 2.8 million people had infections that were actually resistant to antibiotics. And unfortunately, 35,000 people lost their lives because they had these infections that were not responsive to antibiotics. But there is a silver lining, guys, in that we are focusing on urgent care centers. In an urgent care center, one study showed that 7 in 10 people ask for antibiotics, which is not what we want to ask for during the cold and flu season.
Sure.
Interesting.
Let's get into why don't antibiotics work against those viral infections like the common cold and flu?
You know, Jacqueline, that's the million-dollar question, right? Well, we have to understand how antibiotics work, everyone. Antibiotics attach to the cell wall. So imagine a box. The thing is, bacteria have cell walls, viruses do not. Therefore, there is no wall for the antibiotic to attach to. So that's why we're starting to understand, so much so that I partnered not only with Mucinex, but also with urgent care and primary care centers in the United States, so that we have a campaign called Flip the Script. We need to flip the script when we're thinking during this cold and flu season that antibiotics are even necessary. We need to look for things that are over the counter that can really help our symptoms and do so safely.
Yeah, Dr. Redcross, what are some things that we can effectively do to manage then those cold and flu symptoms?
The good thing is there are a lot of different things. There are some things that are over the counter. I've already mentioned Mucinex, but above all, you need to make sure that you also have that relationship with your doctor. All of us are different, and each one of us needs to have that relationship to understand that if there are some things that need to be ruled in or ruled out. But when you think about the cold and flu season, really it's about the symptoms. It's about the mucus. It's about the phlegm. So that's why when I talk to my patients about Mucinex, I know it's going to help with two things: that cough, the congestion, and also not contribute to the antibiotic resistance issue that we're starting to have here in the United States.
Yeah, you know, when you have those symptoms, the coughing like you talked about, it's the worst.
That's the worst.
Absolute feeling. And I think people are just looking for, like, what are those kind of fast,
quick
reliefs that we can get when we have those symptoms, because we're feeling so terrible, Dr. Redcross.
Exactly. And so that's why it's important with this Flip the Script campaign that we're flipping it and realizing, you know, I heard this doctor on air and he talked to me about antibiotics aren't even necessary. There are some things over the counter. But once again, we're staying close with our doctor in this case so that we make sure that we're doing what's right by you, the patient.
Yeah, that's so important. And of course, we want to know where we can go for information about any of these facts you've talked with us about today.
Absolutely. So learn more about the Flip the Script campaign at mucinexfight.com. Some wonderful information there for everyone.
Okay, great.
Yeah.
Thank you, Dr. Redcross.
Thank you so much.
Thank you for having me on, guys.
Absolutely, yeah.
You know, I do wonder, where do we get, like, I just need an antibiotic? You know what I mean? Because I think we think it heals all.
Right.
And we take it for everything.
Absolutely, yes, I know. And just to his point, we don't necessarily need to take it for everything. So, yes, that's interesting. I'm so glad we had that interview today.